Continuing coverage now of school shootings, and the initial shock of a school shooting often turns to emotions of anger and frustration as we learn more about a shooter's past.
Well, tonight we take a look at the role mental health plays in these shootings. NBC 26's Matt Jarko spoke to experts about this key issue and what early signs parents can look for.
Experts say we hear it all the time. A student commits a terrible act of violence, and the reaction is, we knew something was off or different. Experts say awareness of this possible safety issue is rising, but it's still a challenge for parents to step in. In Parkland, Florida, 17 people dead. A massacre carried out by a former student known to have a history of behavior issues. Before that, Sandy Hook. 27 people killed by a shooter described as uncomfortable socially. And in 1999, Columbine, 15 deaths by 2 gunmen who talked about and wrote about violence. Together, 3 shootings, dozens of deaths, and some common links.
Mental health issues related to this are often a disruptive social environment.
Appleton psychologist Frank Cummings says strained relationships with family members or friends can become a high-risk factor for mental health issues.
Kids need to know that there's reliability, there's safety, they're cared for, they're loved.
Without that strong social environment, disruptive behaviors can emerge, things like violent actions, threats, or a lack of self-control. Cummings says after seeing those signs, stepping in isn't always easy.
Making sure that Johnny gets the help he needs can be a real challenge for some parents because they don't want to admit that their kid has a problem or that there's a problem in the home.
But doing something when you see problems like violence or threats can be essential.
What you do as a parent is you make sure that you have your own support system and that you reach out and utilize those resources.
Resources available locally include several behavioral health therapists. Another resource for parents is in the classroom. Officials at the Green Bay Area Public School District say the mental health issue is the #1 aspect of school safety.
We've done a lot of research over the last year exploring what are the patterns in the person that has done the school shootings, and oftentimes there are identifiable steps along the way with mental health issues.
School officials say right now, 6 schools in the district have a partnership with community providers to bring mental health services into schools. They hope to add the service to more schools. Officials say the district is here to help.
It's the old see something, say something. So if I'm a parent and I have a concern about my child, I need to reach out. And if I don't know where to go, come to your school student services staff. So either your child's school counselor or your child's school social worker.
Cummings says the relationship between parent and school official should start right away.
I think it's crucial to have a proactive relationship the first time they walk in the door, whether they be 3 or 4 or 5 years old.
The psychologist you just heard from there says some of the early warning signs of mental health issues can often be solved with good parenting. He encourages parents to reward kids for positive behaviors, but also to correct or discipline what he calls unhelpful or off-task behaviors. He says those consequences should be immediate. Matt Jarko, NBC 26.
Well, if you or a student you love needs to talk to somebody for help, you can call Brown County's 24-hour crisis center hotline. That number is listed on your screen. It is 920-436-8888. It's also listed on our website.